This is a message specifically to doctors of Ukraine. I was born in Cherkasy, Ukraine in 1958, and I was trained in anesthesiology and pain medicine in the United States. I was able to develop PTSD treatment by utilizing sympathetic ganglion block, which is, as many of you know, is an old procedure done clinically since 1925 for various pain conditions. The reason I started doing stellate ganglion block at all for PTSD was due to reading a paper from Finland where T2 clipping were done to get rid of hot hand sweats in Finland, and they found that PTSD symptoms went away. On further research, it became apparent to me that sympathetic system proceeds from the chest or T2 up to the cervical spine and up to the brain. There is a number of studies demonstrating that. My first publication came out 2008, and I can always provide any medical information to physicians who are interested in this. A number of people have now been treated utilizing stellate ganglion block for PTSD. Approximately 4,000 special forces personnel have been treated so far. I personally have treated about 3,000 people with PTSD utilizing stellate ganglion block. My latest publication in 2022 demonstrated that 22 types of trauma leading PTSD were all responsive to stellate ganglion block as far as the treatment. The results can last months or years, and we have done pediatric populations as well. Our cutoff typically is 10 years of age, and that could be discussed, of course. My hope is to be able to bring this to Ukraine. I'm trying to get ultrasound equipment as needed to Ukraine for this, for appropriate guidance. I also am looking for finding appropriate physicians who will become the champions of stellate ganglion block for PTSD in Ukraine, and then become the trainers that will further train other physicians. I am a medical director for Stella Center. We are an international company. We have approximately 45 sites in the United States, and we have 4 sites in Australia, and we opened one in Israel this month. So we do know that this approach seems to work. It can work well. I think the flood of PTSD patients that you're dealing with is unprecedented, and especially acuity of it. But it is possible to treat a large number of people. There is a project we're starting with which will have medical robotics that could potentially extend the ability to do it. But people who are suffering now, I think, would be well served by treatment as soon as possible. At the end of this video, you will be able to see a live patient being treated using stellate ganglion block. You will see a dual block, which is a modification that I developed a number of years ago. The reason it's done at 2 levels, C6 and C4, is that sympathetic fibers seem to originate in T2 level, then go up to C7, T1, and up to the brain. When a C6 block done, a lot of times it does not reach to superior cervical ganglion, which is C3. What we found is that when C3 is also done, the results are significantly better. The reason that is because 50% of sympathetic fibers that originate in the chest synapse in a lower cervical ganglia and ascend to the brain via vertebral artery. The other 50% ascend to C3 ganglia and ascend to the brain via internal carotid, thus affecting a different part of the amygdala and associated limbic system. I think is probably the best protocol available at this time, at least based on my knowledge. We typically do right-sided C4 and C6 blocks because they're available relatively easily available under ultrasound. If there is no response, we do the left side. Not the same day due to medical concerns, but that seems to be the best protocol working for us. If that protocol is followed, our success rate is 85 to 89% of patients will respond significantly to that. Obviously, this controls the symptoms, and again, it may be a few months, a few years, but that could be very much life-saving and life-altering at least. And you will see the live video attached at the end of this, and you can see Horner's, which is a droopy eyeball, and redness of the eyeball, and difference in irises in the patient we treated. I would love to be able to communicate with anybody who is interested regarding this project. We will post my contact information and websites, and then I would like to bring that as an available capability. We're also trying to reach out to the federal government of Ukraine, especially with First Lady demonstrating her interest in mental health. That may be possible, and maybe with support of United States and other countries, the equipment could be available, and appropriate training could potentially be available, and I hope we could change the scourge of PTSD in Ukraine to be significantly lessened by this approach. Thank you, and I hope we can help Ukraine.
I'm a little anxious about the procedure
Sure.
itself.
Well, we'll give you a little versatile, make you a little comfy.
Perfect. But I'm also really, I guess the word is hopeful that
That's the most important thing.
I'm very excited.
So hopefully it works great. All right, then.
Okay,
Let me
all
put
right.
an IV in, and we'll go on.
It's the big boy cuff.
Okay, relax that arm for me. Get go. Okay.
You did a good job.
Did it hurt?
It hurt. This brings back really bad memories of quadruple bypass surgery about a year ago. Because we're only doing one side, correct?
We're doing right side today. If we need to do the left side, we need to figure out another time. We cannot do it the same day. All right, do you mind turning your head that way, sir? Away from me. Thank you. What it allows me to do is move the blood vessels out of the way. Okay, so we're just looking around. Okay. So I'm going to turn on Doppler. See the pulsating thing? That's artery. We do not want to go there. Artery is not the right place to go.
I figured that.
Yeah. This is carotid artery. This is longus colli muscle right here. Longus capitis muscle right there. The target is approximately here, which is sympathetic chain. So we're looking at C6 here. This is C5 here, right here. And this is C4 here. C basically means cervical vertebra. I'll tell you everything you're doing, okay? All right, here you go, ma'am. So you always need to have an amazing assistant. All right, so the needle is bent, so I have a better angle. This is an echogenic needle. What that means it's easier to see under ultrasound guidance. All right, turn your head away from me some more, my friend. Thank you so much. Okay, turning on the colors as Mary calls it.
Yes.
Technically it's called a Doppler, as opposed to Mary vision.
Yes.
Okay, the needle is going in. Click. Okay, aspirate.
Aspirate.
Looks beautiful.
Negative.
Okay,
Going
inject.
smooth.
Yeah, sorry.
It's right where we want it. Okay, Doc, I'm stopping at 4.
Perfect. Go ahead.
Aspirating or negative. Smooth.
Perfect.
Okay, Doc, we're done with that side.
Halfway done.
Switch
You
it.
okay?
Mm-hmm.
You are flush.
Great, thank you. So now we're going up to the next level. I'll tell you later how I came to do 2 levels instead of 1. There's a needle going in. Aspirate here.
Gonna aspirate. We're negative.
Beautiful.
Smooth.
Beautiful.
I'm gonna feel a little more of that pressure. Stopping at 2.
Aspirate here.
Aspirate. We're negative. And smooth. Okay, we are all done. Got that right where
That wasn't too
we wanted
bad, was it?
No.
See?
Got that right
What did
where
I
we
tell you?
wanted it.
I didn't feel nothing. Sorry.
Okay.
Now you have
You,
something
you couldn't help yourself.
I couldn't help it. It's my favorite joke. I've been doing it for 30 years.
Right.
It's my joking routine. Okay. All right, my friend. We are
I'm
done.
gonna take this roll from underneath you. A little bit more comfortable.
Okay.
And we're gonna give you just a moment, and the doc's gonna have you sit up on the side of the bed, and he's gonna evaluate that eye.
How are we doing?
How's it look, Doc?
It's changing a little bit. It's a little red already. It's proptotic, so it's starting to stick out a little bit.
So what's with the eye thing?
So when you knock out the
Back to you,
sympathetic
Peter, for a
system, I've got to cover it now. So sympathetic system or fight and flight system
Right.
keeps your eyes open. When you put it to sleep, the eye droops and turns red usually. So it's just how God built us.
So my question is, so you're looking at my eye, what are you expecting to see?
To droop
Droop?
and change color and get the pupil smaller than the other one. Doesn't always happen, but happens pretty much on everybody.
And how long does that last?
8 hours, 12 hours. It takes a little bit, I mean, it's not immediate a lot of times. So it may take just a little bit.
And then on this side, you want a blanket?
No, I'm actually pretty comfortable.
Okay, cool. I'm just gonna get a couple vital signs from you, and then we'll get you going, okay? We'll take this off.
Thank you.
You want some water?
I would love some water.
Okay.